Welcome. Today we're diving into a rare but devastating neurological disorder called adrenoleukodystrophy, or ALD. Specifically, we will be focusing on the X-linked form, the most common and well-understood type. This genetic condition primarily affects the brain, spinal cord, and adrenal glands, leading to a range of debilitating symptoms. Understanding ALD is crucial for early diagnosis, better management, and, hopefully, a brighter future for those affected. ALD, in its X-linked form, is caused by a mutation in the ABCD1 gene. This gene is located on the X chromosome and provides instructions for making a protein called ALD protein, or LDP. LDP is responsible for transporting very long-chain fatty acids, or VLCFs, into peroxisomes, which are cellular compartments that break down these fatty acids. When the ABCD1 gene is mutated, ALP doesn't function correctly, and VLCFs accumulate in the body, particularly in the brain, spinal cord, and adrenal glands. Because it's X'd, males, who have only one X chromosome, are typically more severely affected than females who have two. Females can be carriers of the gene, meaning they have one normal and one mutated copy. The accumulation of VLCFs in the brain triggers a destructive inflammatory process. These VLCFs disrupt the myelin sheath, which is the protective covering around nerve cells. Myelin is essential for the efficient transmission of nerve impulses. As the myelin is damaged and destroyed, a process called demyelination occurs, hindering nerve function. This demyelination leads to progressive neurological problems. In the adrenal glands, VLCFA accumulation impairs the production of essential hormones like cortisol, leading to adrenal insufficiency. This adrenal insufficiency contributes to additional health complications. ALD is estimated to affect about 1 in 17,000 newborns. Because it's an X-linked disorder, it primarily affects males. However, females who are carriers of the gene can also experience symptoms, although they are usually milder and develop later in life. Newborn screening programs for ALD are becoming increasingly common, aiming to identify affected individuals early, even before symptoms appear. This early detection is crucial for initiating timely interventions and improving outcomes. The signs and symptoms of ALD vary depending on the specific form of the disease and the age of onset. In childhood cerebral ALD, the most severe form, symptoms typically appear between the ages of 4 and 10. These may include behavioral problems, difficulty with attention, vision problems, learning disabilities, seizures, and progressive loss of motor skills. Adrenal insufficiency can manifest as fatigue, weakness, weight loss, and skin darkening. In adulthood, adrenomyeloneuropathy, or AM, is the most common form. Symptoms include stiffness and weakness in the legs, bowel and bladder dysfunction, and sexual dysfunction. Some carrier females may experience milder versions of AM later in life. Diagnosis of ALD typically involves several steps. Firstly, a blood test is performed to measure VLCFA levels. Elevated VLCFA levels are a strong indicator of ALD. If VLCFA levels are elevated, genetic testing is then conducted to confirm the presence of a mutation in the ABCD1 gene. MRI scans of the brain are used to assess the extent of demyelination. In individuals with suspected adrenal insufficiency, hormone testing is performed to evaluate adrenal function. Newborn screening programs utilize blood tests to measure VLCFA levels, enabling early detection. While the underlying genetic cause remains the same, ALD presents in several forms, differing in the age of onset and the primary organs affected. Childhood cerebral ALD is the most aggressive form, affecting young boys and leading to rapid neurological decline. Adrenomyeloneuropathy, or AMN, typically affects adults and primarily involves spinal cord and peripheral nerve dysfunction. Addison's only ALD primarily affects the adrenal glands, leading to adrenal insufficiency without significant neurological involvement. Finally, some individuals remain asymptomatic or show very mild symptoms despite having the genetic mutation. These asymptomatic individuals require regular monitoring. Currently, there is no cure for ALD. However, several treatments are available to manage the symptoms and slow the progression of the disease. Hematopoietic stem cell transplantation, or HSCT, is the most effective treatment for childhood cerebral ALD, but only if performed early in the course of the disease, before significant brain damage has occurred. HSCT involves replacing the patient's bone marrow with healthy donor cells, which can produce functional ALDP. Medications like corticosteroids are used to treat adrenal insufficiency. Physical therapy and occupational therapy can help manage motor symptoms. Lorenzo's oil, a mixture of glycerol triolate and glycerol triuricate, can help lower VLCFA levels, but its effectiveness in preventing neurological progression is debated. Gene therapy is also emerging as a promising treatment option. Because ALD is a genetic disorder, there is no way to prevent the underlying genetic mutation. However, genetic counseling is crucial for families with a history of ALD. Genetic counseling can help prospective parents understand the risk of having a child with ALD and explore reproductive options. Newborn screening programs play a vital role in identifying affected individuals early, allowing for timely intervention. Early detection and management can significantly improve outcomes. The prognosis for individuals with ALD varies greatly depending on the specific form of the disease, the age of onset, and the availability of treatment. Childhood cerebral ALD is the most aggressive form and can lead to severe disability and death if left untreated. Early diagnosis and hematopoietic stem cell transplantation offer the best chance of survival and improved neurological outcomes. Adrenomyeloneuropathy is a slower progressive condition, but it can still significantly impact quality of life. Research into new treatments for ALD is ongoing. Gene therapy holds significant promise for correcting the underlying genetic defect. Studies are also investigating the use of anti-inflammatory drugs to reduce the inflammation in the brain. The hope is that these advancements will lead to more effective treatments and improved outcomes for individuals with ALD.